Hey all, welcome back to the Real Life Pharmacology Podcast. I'm your host, pharmacist Eric Christensen. Thank you so much for listening today. As always, go check out our free 31-page PDF on the top 200 drugs. It's a great study guide, great review if you're out in practice. Simply an email is going to get you access to that, so kind of a no-brainer to go get that at reallifepharmacology.com. The drug of the day today is going to be clindamycin. I'm kind of surprised, honestly. I haven't done this one yet, but I appreciate the podcast listener that reached out and said, hey, cover this antibiotic. So that's what we're going to do. Brand name of this medication is Clindamycin, and this is classified as a lincosamide antibiotic. I know there's temptation for those of you who are maybe new to pharmacology to lump clindamycin in with the macrolide antibiotics, but it is not. So again, the macrolides like clarithromycin, erythromycin, they are different from clindamycin for sure. So mechanistically, how does this drug work? It binds to the 50S ribosomal subunit, which ultimately blocks bacterial protein synthesis. And if bacteria can't produce proteins and continue to function normally, obviously that's going to lead to bacteria's death. Indications. So there are a ton of potential indications for clindamycin. It definitely has some significant gram-positive coverage, and it also has some anaerobic bacterial coverage as well. So in the specific indications, what I have probably seen in practice most is skin and soft tissue infections, so cellulitis, things of that nature. Again, Staph and Strep, both gram-positive bacteria, are often fairly common with that type of infection, or a normal causative organism there. Other indications I have seen, osteomyelitis, pneumonia, maybe diabetic foot ulcers if we've got the correct bacteria that's causing that infection. Some other things you may see, bacterial vaginosis, toxic shock syndrome, sinus infections, or bacterial sinus infections, I should say. And then uniquely, there's some kind of wackier infections too that aren't crazy common. Anthrax, malaria, animal like dog cat bite wound prophylaxis you may see this medication used for as well. So again, a ton of potential indications for the use of clindamycin. Anaerobic, gram-positive coverage is kind of a good thing to remember if you're taking pharmacology exams and things of that nature. One last thing I did want to mention is it typically covers MRSA, so that's a potential benefit. And with the dosage forms that it has, it is a potential oral option for MRSA. Now, there are definitely downsides to using clindamycin, and I'll get into those a little bit. But one of those downsides is frequent dosing. So, 3 times a day, 4 times a day dosing. Probably for like minor infections, you're going to see 300 milligrams 3 times a day, maybe 450 3 or 4 times a day, depending upon severity. Those are going to be more outpatient, milder type infections where it's probably not a life-threatening situation, or at least at the earlier stages of the infection there. The other big thing ties us into adverse drug reactions. So there is a boxed warning for severe colitis with clindamycin, and this is probably the major reason why you don't see it used very often. So it's of all the antibiotics, it's probably one of the highest risk antibiotics for causing or contributing to C. diff infection. So that's an infection that causes some diarrhea and GI problems. That's a boxed warning. Definitely a good one that has shown up for me throughout pharmacology courses, final exams, board exams. That C. diff risk is associated with clindamycin. Other adverse effects, naturally it is an antibiotic, so nausea, vomiting, diarrhea, rash, anaphylaxis risk. Obviously that's probably a little bit lower risk. But I will say something that I've seen show up on board exams as well. HLA-B 5101. So patients of Han Chinese descent are at higher risk for those rash and skin type reactions there. Other rare things that have been reported, acute kidney injury, hepatic issues, not something that I have definitely seen on any type of regular basis in clinical practice. Again, big thing. Think about that colitis C. diff risk for sure. Adding on to that C. diff risk, there's going to be risk factors in certain patients and maybe might hold you back from using clindamycin even more so. So elderly, immunocompromised, you can probably guess a lot of these, live within, a communal or healthcare institution, so, nursing home, things like that. If patients have had GI surgical history, that may predispose them to this risk and make using clindamycin riskier. And then, of course, I do want to mention medications. So proton pump inhibitors, PPIs, like omeprazole, there has been shown to be a higher risk of C. diff when we use these type of medications. And then chemotherapy can increase the risk for C. diff as well there. In relation to GI adverse effects, clindamycin orally can also cause some esophageal irritation. So it's really, really important that you take clindamycin with a full glass of water. So definitely a really important patient education point there to prevent any issues or at least reduce the chance of any issues with that. Pharmacokinetic-wise, half-life, I think... I've talked about this before. Usually the more frequent you have to dose a medication, the shorter the half-life. And this is certainly true with clindamycin. The half-life is in the neighborhood of 2 to 3 hours. And we need to dose this medication usually 3 or 4 times a day to get adequate concentrations because they decrease quickly because of that pretty short half-life. Another thing that may come up if you're converting IV to PO, just a little nugget, the oral absorption is typically very good. So 90% is the approximate absorption of oral administration of clindamycin. So fairly close to 100% there. All right, let's take a quick break from our sponsor and we'll wrap up with drug interactions. If you're in the market for any pharmacist board certification study material, go check out meded101.com/store, S-T-O-R-E. We've got a growing list of resources there for the pharmacotherapy exam, BCACP, geriatrics, BCMTMS, the NAPLEX exam as well. We've had candidates take these exams using our study materials over the last 5 to 7 years. Got a pretty good track record going there. Just have heard back from recent candidates who've taken their exams and got their results, and certainly many of them have passed their difficult board exams. So again, go check that out, support the sponsor, and get some great content as well at meded101.com/store. All right, wrapping up with drug interactions. First and foremost, there are CYP3A4 interactions. So inhibitors, some of the azole antifungals, verapamil, diltiazem, grapefruit juice, some of the macrolides like clarithromycin. These can all increase the concentration of clindamycin, and obviously that's going to potentially increase the risk for adverse effects and risk for C. diff and things of that nature. Inducers, on the flip side, are going to lower concentrations, and we may run into the risk of treatment failure. Examples of CYP3A4 inducers, St. John's wort, carbamazepine, rifampin. So again, these can all lower concentrations of clindamycin. And lastly, with drug interactions, I definitely wanted to mention PPIs. It's definitely something I have asked for, reducing or at least trying to minimize the dose in patients who have had C. diff. So if we've got a PPI on board and we're using clindamycin, keep in mind that increases that risk for C. diff infection. So definitely pay attention to that. That is something that I've definitely recommended periodically throughout my career, particularly in patients who've had recurrent C. diff infections. Pay attention to the PPIs and potentially look for alternatives to clindamycin in that type of situation. All right, well, I think that's going to wrap up the podcast for today. If you enjoyed this episode, found it helpful, please do us a huge favor. Leave us a rating review on iTunes or wherever you're listening. We greatly appreciate that. Reach out to me, mededucation101@gmail.com. I do my best to respond to every single email I get. Sometimes it takes me a couple days just for me to get caught up and that type of thing, but absolutely don't hesitate to contact me there. With that said, I'm going to sign off for today. Thank you so much for listening, and I hope you have a great rest of your day.